are here at the annual meeting of the North American Menopause Society, and I have the pleasure of speaking with.
The president of the North American Menopause Society, Dr. Marla Shapiro.
And you also have a very prominent media position.
I do. I'm the medical consultant for one of our major networks in Canada, and I do a lot in print media as well. So as time has evolved, I've become a medical journalist. It's been interesting.
Very cool, and you do a great job at it. Well, you were here at the meeting and you were really talking about the impact of social media, basically on a lot of aspects, but I wonder we could switch it around just slightly and say, if you're a woman and you are in midlife,
right,
what do you do with the social media? How do you understand it?
So I think firstly, people have to understand, and women have to understand, that social media is an echo chamber. It really is an echo chamber. Nothing is really vetted on social media. You can say whatever you want. If it's the Twitter world, it's 140 characters. It is what it is. It's out there, it's social, and as we call it, socialnomics. It has a lot of value because it's shared, but just because it's shared and just because it's on social media does not necessarily mean that it's either evidence-based or accurate or even has anything to do with you as an individual.
So social media is a reflection of society, not an image of society.
Yeah, but it's only a reflection of a certain part of society. You know, it doesn't necessarily reflect all of society. It reflects a segment. And we see that, for example, when we look at simple studies like uptake of flu vaccine. If you're in an area where there's a lot of action in social media that's anti-vax in terms of flu vaccines, you'll see that it's quite viral. And even though it's not validated or evidence-based, you'll find communities, pockets of communities, that therefore don't uptake of the flu vaccine. When we look at social media, and one of the most prominent cases that I can think of in terms of women's health was Natalie Morton, who was a 14-year-old girl who got an HPV vaccine and then died. And the whole program was stopped, and the headlines were right away, true and related. She got the vaccine, she died from the vaccine, and as it turned out in the autopsy within 48 hours that in fact she had an underlying cardiac congenital defect, and her death had nothing to do with the vaccine. And in that case, social media was very effective in opening up chat rooms and having discussions about what happened and doing it and responding very, very quickly to the event. So in that case, social media was able to pretty much put out a fire, if you will, of stopping a program dead in its tracks. In Japan, for example, on the other hand, where there was an epidemic of fainting after the HPV vaccine, basically it became viral throughout the entire country. It was cause and effect, and it essentially has stopped their vaccination program. So social media can be quite dangerous, and it can be all-consuming. So you have to be quite cautious about social media.
So if you see a headline, and you made a point yesterday that social media often follows the headline, give me the headline. When people see a headline, what's the next thing that they should do to vet what they see?
It's a good question, because sometimes even when you read the article, it's someone vetting it for you. So, if it's something that's of great interest, I think you have to do your due diligence. Either find an expert that you trust who can help you, go through it. Women say to me, you doctors change your mind. And it's no, not at all. I don't think that we're changing our mind. As science evolves and information evolves, and this is a very complex field, we have more information to make recommendations that may seem as if we've changed our mind, but it's not a question of changing our mind as much as it's incorporating the data and going forward. Many articles are written based on an abstract or based on the press release, as opposed to really reading the article.
A summary of a summary.
A summary of a summary of a summary.
Of a summary.
And for example, when I think what our downfall was, perhaps with the Women's Health Initiative, is that when the data was reported, we did not emphasize at that time that it was across all age spectrums, that the numbers we got were numbers of the entire group together. So, if I'm a 50-year-old woman in the study, and there's a 70-year-old woman in the study, just by virtue of age alone, our risks for breast cancer, our risks for heart disease are completely different.
Absolutely.
So when we get one big number, we didn't, really emphasize, one, that this was the entire cohort, and we need to look at it by at least decades to see if it makes a difference, because age makes a difference. When I ask my residents, what's the biggest risk factor for breast cancer after being female, it's age. And the biggest risk for heart disease is age. We know that women are a decade later than men, and then we lose our estrogen protection and we catch up very quickly in terms of cardiovascular disease. So it's not one shoe fits all sizes. And when that study first came out, those headlines, hormone therapy harms, hormone therapy causes heart disease, there was no context. And that's the problem also with social media, that it's information without context. And without the context, you really can't make a decision.
Any last point you want to make?
Yeah, I think as women, it's very confusing. I think that a lot of changes in our body happen, and it's very difficult to tease out. Is this menopause? Is this aging? Is this a combination of the two? So, and I would tell women that education is your most powerful tool, but where you get that education is critical. And before you start getting educated, get educated about where you should get educated, and then go from there.
Thanks very much.